Hello everyone. In this video, I am going to discuss about phosphorus. Phosphorus is one of the most fatal inorganic irritant poison. There are two varieties of phosphorus. Number one is the white or the crystalline form, and the second one is the red or amorphous form. It is the white or the crystalline form that is actually used in fertilizers, insecticides, rodenticides, bombs, fireworks, etc. Remember, it is a protoplasmic poison, that is, like most of the metallic poison, it is going to affect the cellular oxidation. The symptoms and signs of phosphorus poisoning can be classified based on the type of poison. Suppose if it is fulminant poisoning where more than 1 gram of the phosphorus is taken all at a time, cardiovascular collapse occurs within 12 hours because phosphorus have a direct toxic effect on the heart and the blood vessels. Okay, yes. And remember, if the patient survive more than 12 hours, mostly they will be having nausea, vomiting and retching. Coming into the acute poisoning. The acute poisoning can be classified into first, second and the third stage. First stage, there will be local irritation, and because of the direct ingestion of the phosphorus, there will be pain in the throat and abdomen with intense thirst, nausea, vomiting, severe abdominal pain. Very important, acute phosphorus poisoning, the breath and excreta will be having a garlic-like odor, and the vomit and the feces will be luminescent. Very important, children. Here comes the question: out of white and red phosphorus, which is luminescent? Remember, it is a white phosphorus which is highly toxic one. It is luminous in the dark. It is having garlicky odor and garlicky taste. And it is this which is type of phosphorus that is used in rodenticide, fireworks, gunpowder and fertilizers. Whereas red phosphorus, that is usually seen on the sides of the matchbox, that is non-luminous, odorless, tasteless, non-oxidized, non-inflammable and non-toxic. Coming into the second stage, it is actually a symptom-less period. Okay, that is, there won't be any symptom which lasts for around 2 to 3 days. And the third stage, there is nausea, vomiting, jaundice, pruritus, hematemesis and hepatomegaly. That is, tender hepatomegaly is a feature. And hemorrhages also occurs in the skin, mucous membrane and the viscera. In the renal, there will be oliguria, hematuria, albuminuria, and CNS manifestation will be in the form of convulsions, delirium and coma. And the death is mainly because of shock and hepatic failure. The fatal dose is 60 to 120 mg. Fatal period is 2 to 8 days. And treatment, very important, gastric lavage is indicated using 1 in 5,000 solution of potassium permanganate. Activated charcoal also used. Then another important thing, copper sulfate solution. I have told this in copper while discussing the copper topic itself. I have told you copper sulfate or the blue vitriol, okay, or yes, the bluish green compound that is used in phosphorus poisoning, and this has been asked in the AIMS PYQ. Okay, copper sulfate solution is used in phosphorus poisoning. Then vitamin K, because it helps to improve the coagulation status, and then bowel wash, okay, can be given. And I told you if any burns are there, you can go for copper sulfate wash. Then coming into the postmortem appearances, okay, I told you when it comes to phosphorus, which is the one organ which is going to get damaged here, it is liver. That is why phosphorus poisoning mimics the acute yellow atrophy of the liver. In phosphorus poisoning, the liver will be marbled, soft, greasy and friable, and there is fatty degeneration with small hemorrhages. Whereas remember, the supporting connective tissue remains intact in acute yellow atrophy of the liver, and the liver will be soft and flabby. Okay, then coming into the postmortem appearances, children, I told you there is irritation. There will be luminous material which will be present in the stomach and bowel. There will be signs of jaundice also. Okay, there will be multiple small and larger hemorrhages. Remember, very severe. I told you it has a direct toxic effect. Okay, protoplasmic poison. It affects the cellular oxidation. Direct effect on the blood vessels and heart. It causes what? Small and large hemorrhages on the skin, subcutaneous tissues, muscles, and everything. And the liver becomes swollen, yellow, soft, fat. Okay, and that's what I told. It almost what mimics like an acute yellow atrophy of the liver. And the kidneys, again, it will be large, hemorrhages will be present, and remember, it has mainly effect on the heart and blood vessels. Liver is the other organ which is commonly affected here. The heart will be flabby, pale, shows fatty degeneration. Yes, so the liver and heart, it almost mimics like of a fatty degeneration. Yes, here comes the next question. What is the changes that happens in chronic poisoning? See, because of the frequent inhalation, chronic poisoning means what? The mode will be inhalation of the phosphorus fumes. There will be necrosis of the lower jaw. Okay, and because of this necrosis of the lower jaw, what will happen? There will be swelling of the jaw, loosening of the teeth, necrosis of the gums, sequestration of the bone in the mandible. This is what we call it as the acute osteomyelitis and necrosis of the jaw, or the foci jaw or the glass jaw. Remember, foci jaw, glass jaw, all these are the names that are asked in the short note question. There will be, it is nothing else but an acute osteomyelitic condition. Okay, it is like a bone infection mainly affecting the mandible. Okay, yes, and the jaw. So there will be multiple sinuses which discharge foul smelling pus. So that is very, very important. Foci jaw is not seen in acute poisoning, it is only seen in chronic poisoning. Coming into the circumstances of poisoning, yes, mostly by what? Accidental ingestion by children in the form of from the fireworks or eating rat paste and everything. Yes, then coming to the next important poison, children, yes, that is again asked in the exam. Iodine. Iodine is something that you always ignore to read. It is a bluish black, soft and scaly crystal having a metallic luster and an unpleasant taste. It is usually a violet colored vapor at all temperature, having a characteristic pungent odor. Again, it is a protoplasmic poison which affects the protein synthesis. Okay, it causes necrosis and it is a respiratory irritant. So inhalation produces glottic and pulmonary edema, and when it is swallowed in the solid form, that is very rare, it causes what? It's like a corrosive, and there is burning pain extending from the mouth, the stomach, intense thirst, salivation, vomiting, everything you can write. And you know, the lips and angles of mouth are stained brown. That is again a classic postmortem finding. Okay, and remember, the vomited matter exits a dark yellow or blue in color because of the what? And it has a peculiar odor of the iodine. Okay, and the patient will be usually having metabolic acidosis. Okay, renal failure occurs because iodine, it causes PCT necrosis like our mercury, and the fatal dose is 2 to 4 gram. Fatal period is 24 hours. Again, we can use very, very important starch. Okay, soluble starch and albumin is used to what? Evacuate the stomach content, and you can also use sodium chloride that will increase the excretion of the iodine. And postpartum appearances, I told you, inflamed, excoriated, and all the content will be but brown in color, okay, or bluish brown in color. And the heart, liver and kidney may show fatty degeneration like that of the phosphorus. And coming into the chronic poison, that is called iodism. Okay, here very, very important, what are the organs that are mainly going to get affected here? There will be what? Nose. Okay, it is the nose and the paranasal sinus, especially the frontal sinus. Okay, and there will be parotid swelling, and that is called iodide mumps. So remember, and there will be erythematic patches on the skin in the form of urticaria and all. Okay, that is what we call as iododerma. Okay, so in iodism, frontal sinus affected, parotid swelling and erythematous patches on the skin. And remember, it very rarely only it causes poisoning, because iodine is converted into what? Iodide. Okay, that is responsible for our thyroid hormone synthesis also. Okay, so just remember that. But still, in cases any poisoning occurs, okay, because of the fatal dose, like 2 to 4 gram, and what will happen? Iodine poisoning occurs, and here the frontal sinus will be affected, iodide mumps or the parotid swelling, then running of the nose, then erythematous patches, everything occurs. Remember, dark yellow or blue in color, metabolic acidosis, renal failure is the cause of death. Starch and albumin, soluble starch and albumin is used in the management, okay, for wash. And even sodium chloride promote the excretion of iodine. So these are the important things. Remember iodine. Remember, white phosphorus is toxic. Red phosphorus is not toxic. Remember, copper sulfate is used in the treatment of phosphorus poisoning. Foci jaw occurs in case of chronic poisoning.